since we've seen Jabi before, it's easy to pull up his radiographs from before. So all we need to do is we come into our program, we select our doctor, and we look up Jabi. Select him and it'll pull up his radiographs from previous procedures. For lateral abdominal view, the first thing we're going to do is we're going to measure Jabi. So we're going to use our calipers and we're going to measure him at his thickest point, which is generally over the last rib. And he is about 10 centimeters. So according to our technique chart, the abdominal list, our thickness is 10 centimeters, so our KVP is going to be 51, and our MAS is going to be 8. So we're going to come over to our machine. So our KVP, 51, and our MAS will be 8. And since we are using cassettes, we have 2 different size cassettes. We have a small and a large. This is our small one. We use the small one for cats, small dogs, and when we do limb radiographs. So I have this on a table under our beam. And at this point, we're going to put Jabi in right lateral recumbency. Okay, bud. Also for this, his forelimbs are extended cranially and his hind limbs are extended caudally. So the center of our beam is going to be slightly caudal to the last rib. So right about here. And for our collimating borders, our caudal border is at the coxofemoral joints. Our ventral border is at the sternum. So we make that a little bit smaller. Our dorsal border is at the spinous process of the vertebral column, and our cranial border is halfway between the caudal border of the scapula and the xiphoid process. Which would place Jabi right about there. We have our lead marker, our right lead marker, which is going to go within the collimated area at the inguinal region. Oh, I'm sorry. I know, I'm sorry. And our x-ray is going to be taken at respiratory pause. So Amy is going to hold, I'm going to hold Jabi while she gets on the rest of her PPE. So I have our exposure, so we're going to come this way. I am far enough away. X-ray. Positioning for craniocaudal radius and ulna includes the patient to be in ventral recumbency. Collimating includes proximal to the elbow and distal to the carpus. And we want to center the beam on the mid shaft of the radius and ulna. And for this view, we're going to measure at the mid shaft as well of the radius and ulna, just like centering. For ventrodorsal thorax view, patient will be in dorsal recumbency in a V trough. Collimating includes cranially at the thoracic inlet, caudally at the first lumbar vertebrae, and laterally at the body walls, including the V trough in your radiographic view in your collimating area. The center should be at the midline level to the caudal border of the scapula, and measuring will be at the highest point, usually the last rib. For ventrodorsal projection of the pelvis, usually for OFA, the Orthopedic Foundation for Animals Quality Images, the patient is going to be in ventral recumbency in a V trough. We're going to collimate cranially, which is just cranial to the crest of the ilium. Caudally will be just distal of the patellas. Lateral will be the lateral to the great trochanters. and the center of the beam will be midline level with the ischial tuberosities, and measuring your patient should be at the thickest part of the pelvis.